Welcome to our Global Health Conversations. I'm with Ms. Jennifer Dent from the Bvgh for Global Health. I got it after a third time, but we're here at the Global Health Catalyst, and welcome to our conversation.
Thank you. It's lovely to be here.
Lovely to be here. And maybe perhaps before we jump into it, if you would tell us a little bit about yourself and your role is, what your role is.
So my background is working in the private sector. I worked for, very early on, what is now Pfizer, and then Genentech, and then Roche. I joined Bioventures for Global Health, or Bvgh is a little easier, more than a decade ago, to bring my industry experience really to the global health field. And just a little bit about the organization. The organization was founded more than 20 years ago by BIO, the Biotechnology Innovation Organization, which launched Bvgh as a platform, as a nonprofit organization to engage the private sector in public-private partnerships to improve global health.
Well, we could just piggyback off of that and just talk about the trends in cancer. So, are certainly biotech companies and all these interventions are a response to a problem. So in your line of work, what are some of the trends that you have observed that need urgent intervention?
Well, really the trend that led us, or what we saw that led us to launching the African Access Initiative in 2017 was the fact that we're seeing great advances in cancer care in Western, wealthier countries. I mean, in the United States, we're seeing a steady decline in mortality, a slight decline, but a steady decline over the last 2 decades, really primarily because of innovations in the cancer space. But at Bvgh, in our work in infectious diseases and in non-communicable diseases, particularly in Africa, we were hearing that cancer was a death sentence, and that patients, communities, even African healthcare professionals were not seeing the same advances that we're seeing here in the United States, for instance. So when we started to look at that data and see the trends and the projection of really the dismal increase in incidence and mortality, we launched the African Access Initiative to address some of those issues. And what we saw when we started to really look at the data was African patients are presenting differently with their cancers. They have different genetic profiles, they eat different diets, they live in very different environments, and the healthcare systems are different. So we need research, we need studies, we need partnerships to tackle some of these issues. And that's what we are working on through the African Access Initiative, and what really brings us here today to the Global Health Catalyst Summit to talk about some of those partnerships that are really rooted with the leadership in the Global Health Catalyst Summit.
Right, and you've mentioned a few things that are very, very important, which are the differences in genetic makeup of Africans, the different biomarkers when you're looking at breast cancers and all these cancers. So what are some of the initiatives you're a part of? I know you've talked about the Access project related to Access. What are they, and what are they trying to solve?
Well, some of the initiatives, we're partnering at the government level, but also at the hospital level in the countries that we're working in. And one of the initiatives really stems from our partnership with the government of Nigeria and the Nigeria Sovereign Investment Authority and MedServe, which are investing in state-of-the-art cancer centers, and public-private partnerships and research are central to their objectives. So through that, our work with NSIA and with hospitals in Nigeria and with stakeholders at the Global Health Catalyst Summit, we've built a number of partnerships that we're managing to generate data in African ethnicities. A couple of those are, one is the Hypo Africa. study, which was a study that has now fully enrolled and has published multiple publications and is a network that meets weekly. It's a very, very strong network to address quality control of their systems. We engage like world-leading medical physicists, radiation oncologists, technicians, and nurses and staff that work in radiotherapy to really help to build some of their specialty skills and experience through shared learnings. But also as they are obtaining more modern new equipment, we really need to expand that workforce. And we're working in partnership with the Nigerian government right now and also with the Global Health Catalyst Summit team to conduct training and to help them, what they say is build their oncology workforce in the country. We have another study that we're very excited about that was championed again by the Nigerian government in pediatric cancer. And we have 8 sites across Nigeria that are conducting a cost-effectiveness analysis on the treatment of pediatric cancer. And we are working with faculty at Sick Kids Hospital in Toronto to kind of really help advise and share some experience in that area.
Well, first of all, amazing projects. All of them are amazing. But I happen to, once in a while, I sit into the weekly meetings for Hypo Africa, every Saturday. And it's been amazing to watch the different physicians and clinicians from and researchers from the different countries work together, talking about toxicity levels and, the different biomarkers. From your experience with at least Hypo Africa, what have been some of the key things that have stood out in terms of these partnerships, especially given that there are different countries participating?
Sure. Well, I think like any partnership and relationship, it's the commitment of the individuals, and it is the individuals that make this work. Because as you said, this is every Saturday morning. Well, it's very early morning for us
Yes.
where we're based, and we have people around the globe that are taking time out of their Saturdays to participate in this in this initiative, in these weekly meetings. And it's the commitment of the individuals not only to share their knowledge and their experiences, but also to really build their own knowledge so they can train the next generation of radiation oncology healthcare professionals. So I think that's critical. I also, maybe I'm a little biased here, but I think Katie Graff at Bvgh plays a key role because Katie convenes that group and
She's
sets
fantastic.
the agenda. Thank you.
She's very fantastic.
So I think Katie is really a big part of the glue, and I think everyone that's involved in those weekly sessions has told me that without Katie, those would probably not still be happening. And then she's also a scientist herself, so she's been, I think, really instrumental in helping to develop some of the abstracts, some of the bio sketches for the team when we've applied, and she's really helped to coordinate some of those applications and input of data to the NCI and other funding mechanisms. So I think it's every one of the individuals. I think Katie plays a particularly special role as really an alliance kind of coordinator of that network. But I think it's every single individual that makes it very, very special, and it's an initiative that's built on a foundation and is expanded, and I'm really excited to see where it goes next.
Right, and Katie does all this with so much grace, so much calmness. Oh my goodness, I hope we'll have a moment, get her here to speak to our viewers, but yes.
I hope so too.
And BioVentures, really, thanks for taking a leadership role in that, because you are working together with GHC to get this done, and we don't take that for granted.
It's really our pleasure. That's what we love to do.
Yeah, really, thank you. And is there are there any lessons that you have learned through your 3 big projects that you've highlighted that almost are cross-cutting and also things that other people who are working on bridging the same disparities, because cancer disparities are broad.
Yeah.
And when you look at Hypo Africa, it's really focusing on radiotherapies and stuff like that. So in that context, are there some best practices in terms of cross-cutting best practices?
Well, I think one of the best practices that we apply that's really helpful is being very transparent within the institutions that we're working with. So although we work with PIs, leading PIs at each of the 4 sites across Africa that are part of Hypo Africa, we also make sure that the chief medical directors, the heads of the hospitals, the broader community at the hospitals know about this study, and we're also communicating this study to the ministries of health in those countries through our communications, because that also provides support to those PIs and gives recognition to them. We think that's important, and there's so much change in the world. Not just having one single relationship, recognizing that different individuals bring different skills and expertise. So, broadening and welcoming new experts to our network, like Hypo Africa, which we've certainly been able to do, and tap into, some different leading medical physicists as part of that initiative.
Right. Well, we've heard about the amazing part, but I can't let you go before I ask, what are the biggest challenges of doing the work that you do?
Wow. Well, the biggest challenges, of course, are really sustainability for an organization, and really, deciding what you're going to focus on, and then funding is always a challenge. I think whether it's the academics, whether it's even the private sector, or certainly our partners in Africa, and that's why I think cross-sector partnerships, public-private partnerships, are really a powerful mechanism to align these different groups and bring funding together from all the sectors.
Looking ahead, what are some of your key priorities and your vision for the next 5 to 10 years in terms of the work you do and in terms of partnerships?
Yeah, well, one of our key priorities, and since we launched the African Access Initiative, working on Hypo Africa, radiotherapy is such a critical element of cancer treatment and care. So it is a really important initiative, but we also have to think about that entire patient pathway. So it's really about the connectivity from the public awareness and education among community members. So working with the primary healthcare providers, helping to support navigation and leveraging technologies to do that. I think there's a huge opportunity, and we're looking at a number of different partnerships that bring technology and even AI into really empowering patients to be able to navigate their cancer care and have readily available information about critical aspects like what is covered from a payer standpoint, where are the services available, and what services are available at different sites. So it's really covering that entire patient pathway and linking it together and leveraging technology to do so.
All right, and is that, how does it tie into your partnership with the Global Health Catalyst, or are there other ways that you're partnering with the GHC?
Well, there's other ways that we're partnering across organizations and with the GHC too, like thinking about other cancers. We launched in prostate cancer with the Global Health Catalyst team. We're also expanding, and we have an ambition to expand to many different cancers that are prevalent and problematic in African ethnicities and are a priority for the governments. But we're also, as we run these studies, we need to navigate patients into these studies, and they also need to receive treatment. So we're working with leading international companies that want to make their cancer medicines available in a more sustainable, a more cost-effective manner, and in partnership with governments and hospitals. So we're also, access to medicines is critical. The conduct of research is critical. So these pieces they're complementary to the Global Health Catalyst, and they intersect with it, but they're also big efforts on the part of BioVentures for Global Health.
And I thought I was going to have one last question, but I have really one question that I have to ask, which comes down to access.
Yeah.
You know, the research is great because it gives organizations, countries, a baseline for the interventions that there and the cancer control programs and all that. But it also comes with a cost, which is the cost for example, radiotherapy. The equipment is quite expensive for many of these countries. What has been your observation, and what can be done, to support these health systems that are not as strong?
Yeah, I think it's a major challenge. I do think that when you see governments in Africa investing heavily in this very expensive, very innovative, critical equipment, then I think that's where partnerships like ours with the Global Health Catalyst really need to come in to help support, to build that capacity and help actually operationalize that equipment to allow it to maximize the benefit that patients deserve in these countries. So I think we're actually seeing a lot of investments in radiotherapy, particularly right now in Nigeria under the government with their the President's Health Reform Initiative and NSIA's investments. And they're taking a very holistic approach too, which is very encouraging. And from what we see, African countries look at each other and they also step up. I mean, there's a lot of strong countries that are investing in radiotherapy.
Yeah.
And so it's really building the partnerships to help them realize the potential of that therapy. And I think we're going to see the continent and many of these countries, I mean, really leapfrog and catch up, because they are much more technologically savvy and advanced than, frankly, I think most Americans are.
That might be true. And which brings me to really one final question, which ties into communication. That is one of the areas that I truly advocate for. There is research is done, carried out, and we have all these amazing conversations and conferences. But oftentimes, communicating cancer to the most underserved communities becomes a challenge. What has been your observation in terms of translating all this research into meaningful communication strategies, and what are some of the areas that need improvement that we can support?
Well, that's a fantastic question, because I agree with you. I think communication is so important, and thinking about the different cultures and the different ways that different cultures interpret information. And so we have been working in collaboration with a number of advocacy groups in the countries that we're partnered with through AAI. And we find they're the ones that know best how to communicate to communities. And so what we have done is we have co-developed and designed materials in partnership with, for instance, we're working with the First Lady of Kwara State right now, and she's a strong advocate for healthcare. So we have been customizing and developing materials with her team, and then translating those with local expertise into the local languages. We've also found media actually is even more powerful in African countries than it is, I think, in the United States. So the media is another great channel where we're actually very excited about a program we're launching in Côte d'Ivoire, which will be a bus campaign where we have two really influential men that are followed widely in Côte d'Ivoire, that will be conveying messages about men's health, and will be conveying those messages on bus videos to help inform people about the early signs and symptoms and what they should do and where they should go.
That is very timely, because men are one of the demographic that doesn't pay attention to health unless they are really ill and need to go to the hospital. I know women were also prone to that, but mostly, men in our communities. So it's exciting to know that there are programs like that. We need more we need those scaled out in other areas in Africa at least. So with that, is there anything that we've left out that you'd like to tell our viewers about anything you've done, best practice, a piece of advice, or yeah? Anything?
I think everyone talks about partnerships being so important today, and partnerships come in different shapes and different types, and so I think just keeping an open mind to partnerships, and when you do form partnerships, aligning partners on what is it that we want to do together.
Absolutely. Thank you, Jennifer. It's been an honor.
Really a pleasure.
All right.
So nice to be here.
And to our viewers, I hope you've learned about what BioVentures for Global Health is doing behind the scenes. You can learn more from their website, and also feel free to ask questions or to follow what they do on their social media. So with that, thank you for watching. Till next time.